City News everywhere.
So I sat in the hospital the whole day, and the reasoning was because there was no staff. They said, if you give birth, if we induce you and you go into labor, we have no one to deliver your baby.
What I'm sad to say that the situation is critical now everywhere around the province.
Montreal maternity wards suffering from staff shortages, some even having to transfer patients to other hospitals or temporarily close.
That evening that I ended up being alone, I wasn't induced. I was just basically in holding. Not one person came to check on me. Not one person came to see if I was okay. Just let me go home, let me go home. Let me go be with my son and then call me when you're ready for me. And they're like, well, no, if you do that, then you lose your spot. And I'm like, what do you mean I lose my spot? Like, at what point am I a priority?
Why is it that our system can't help me get provoked and have a healthy baby instead of waiting, pushing it back until I become a critical situation as well? I became a critical situation when they finally admitted me into the hospital.
Many new mothers on social media saying the birthing experience at hospitals like the Jewish General Hospital were relatively pleasant, but staff shortages could be felt. Some saying hospital rooms were dirty and there were unnecessary complications during delivery and postpartum.
It takes specialized nurses to do that work. So you cannot take a nurse from the external clinic and just say from one day to the other one, you go now to the obstetric ward and then you do your work over there. Because it takes training, those incentives to make nurses interested in going through all that process came a little bit too late.
The contradiction in information, bringing you the wrong discharge papers. It was the discharge papers of another patient. So it makes you question, are you aware of my situation, of my file? Do you understand what I've been through? Or are you confusing me with another patient?
The Quebec Ministry of Health says it is aware of the situation and will continue to support institutions in decision-making processes and application of measures to avoid a reduction of frontline services. The McGill University Health Center saying it has been working on a contingency plan and taking the necessary steps to reorganize the care and services offered to minimize repercussions on patients. In Montreal, Brenda Enriquez, City News.